And so I started looking for a doctor who would consider prescribing those sorts of medicines, and finally found one. And I tried that medication, and two things. One, it was very difficult to use. It's very strong, and it also takes forever to take action, and it's very variable because it goes through your digestive system. Sometimes you take it, you don't even notice the impact. Other times you take it and it knocks you out. But it did start working on my migraines. So I've been using that for about 3 years, where the whole time has really been trying to titrate the dose to be able to treat the migraine without having all these side effects you get with Marinol. It's very psychoactive. It causes very anxiety and some other things, and it's extremely slow acting, so it makes it very hard to titrate. And I've been using that for about 3 years, though recently I started really overreacting to it, where the anxiety from taking it was just so severe I actually went off it for about 3 weeks. And that was unfortunate because my migraines came back full-blown. I realized that I needed to stay on this drug to be able to keep the migraines under control, but I'm not happy about taking it. It's very unpleasant.
I have seen a few patients who have used Marinol. They do not report as good of effect as they do with smoked marijuana. As with most of the natural substances that are used medicinally, there's usually a lot of different active ingredients.
Yeah, it increases my appetite. It decreases the spasticity of my muscles. It decreases the episodes of emotional lability that I have, which is actually a big thing. And it kind of gives me a little bit of energy when I don't really have it, because you get really fatigued with MS. And so it kind of helps with those issues. There are additional areas that other people use it for, and there are plenty of studies that show there's additional documented applications for it. But for my own personal application, when I was smoking it in Arizona, that was the area that we looked at. This is going to actually probably help the best.
I have no idea why it was better. All I know is it worked, and I'm thankful that it was available to me at the time.
My life is like I'm in a twilight zone. I never know from one day to the next what it's going to be like. I never know if I'll be able to eat or function or get up and walk across the room. I no longer socialize like I used to. I miss working. I miss my life. But I'll never get it back. You cannot repair the damage of multiple sclerosis. I believe so strongly in this. I believe so much. I have a very good friend that died from MS. She weighed only 65 pounds. She was diagnosed 6 months before me. She died in 1999, just down the road. And there was nothing that they could give her to help her pain and suffering, because all these prescribed marijuana, people had offered her marijuana, but like me, she wasn't, because it was illegal. She didn't want to set a bad example for her children, and she died suffering. And I don't want to go like that, and I wouldn't want anybody to, in their final days, not to have some relief legally without the threat of the DEA busting into their house, dragging them away. You know, I believe, like I said, so passionately about this, and anything that I could do on my small part to help someone. So many people have this disease, so many. Some of these treatments cost $20,000, and marijuana is a little plant that could be used so much cheaper. My medication right now, and I'm on nothing that's addictive, is into, I'm going to say, $600 a month. I have, of course, a medication card, but that's what it costs. But marijuana, it'd be so much cheaper. It's more cost effective, and there's no side effects, and it won't kill me or you or anybody else that needs to use it legally.
Oh yes, my experience really has changed. My opinion both of marijuana itself and state and federal government. You have to understand, when this started out, I really did not believe that cannabis had any use as medicine. I remember back in the 70s, I knew some people who were using it medically. One guy who had partial severing of his spinal cord was using it to prevent spasms. And another person was using it for MS to treat, which I now know is neuropathic pain. Now, at the time, I thought it was just, they needed some excuse to use it. I didn't really understand it. And that was really my opinion of marijuana itself until this came up. So I guess, you have to be exposed to things directly to understand sometimes what's going on. And I feel like maybe this is the opinion of many politicians who have not had a direct involvement with diseases that are treatable with it.
I have to say that this is probably one of the most troublesome parts of understanding the government's position, is that we have what's called a therapeutic index in all drugs, which is the ratio of beneficial effects to toxic effects, basically. So if it takes a dose of 1 to help you and a dose of 2 to hurt you, that's a really narrow therapeutic index. And we have drugs that are like that, where twice the amount of a normal dose can actually be toxic. I don't know that there is a toxic dose of marijuana. I've been practicing emergency medicine for 20 plus years. I have never seen an overdose of marijuana. I've never seen somebody who presented with significant marijuana side effects. I'm sure there's an awful lot of usage going on in the community, and yet in spite of all of the other patients that we see with significant side effects from both prescribed and unprescribed drugs and overdoses and abusive drugs and all of the other things, I've never seen a patient in all of my years who presented primarily with symptoms of marijuana overdose. So there's probably very few, if any, drugs that have the kind of therapeutic index that marijuana does in terms of toxic effects.
Medicinal marijuana helped me considerably because it alleviated most of my feelings of nausea and physical discomfort recovering from severe chemotherapy use. I did not feel as though I had any negative kinds of side effects other than an improved appetite and improved sleep and reduced anxiety. I cannot remember anything negative about taking marijuana during that time of chemotherapy use.
But I think we're talking about a very different issue now, and that is what are the actual damaging effects of marijuana, and if there are some, they would come out if we could do some research on it. But studies right now just don't provide any information to suggest that there are legitimate issues in terms of toxicity for marijuana.
The issue for medicinal marijuana should only be between the physician and the patient. The problem is that the government is kind of reaching right now.
If I didn't have this available to me, I think that the treatment process would have gone a lot slower. It would have taken a lot longer to recover in between chemotherapy treatments. I would have had to have stayed in the hospital a lot longer.
I think for cancer patients, it's good for an antiemetic. It makes you stop from throwing up. It actually helps them increase their appetite, which is good, because when you're having cancer and you're on chemotherapy, you're gonna have a decreased appetite. You need some energy, so it's going to help with that.
So I think that, again, the majority of physicians that I've spoken to who want to talk about it would support the legalization of medical marijuana. I don't see a lot of them looking at this, and I don't look at this as an overwhelming issue. I mean, it doesn't affect a lot of my patients. But as I've said to other people, if it's you, if you're the one on chemotherapy and you're the one that is wasting away and you're the one that it benefits, then the numbers of people in the community affected really doesn't matter. It's 100% for you. And that's my concern, is the well-being of each individual patient that I see. And I just feel it's my obligation to say what needs to be said. I am a person who is trained in these areas. I think that it's the right of the public to hear from people who do treat patients and are willing to speak and say what is in the literature.
Please, if not, like I said, not for me, for those that are terminally ill, allow the use of marijuana. It's so much safer than these chemicals they keep prescribing for us that are worsening what little bit of quality of life that we have with these diseases.
Anybody who's been on any serious medication knows the sort of side effects you get with most pharmaceuticals. I certainly have been through the ringer on those. And compared to those, even the psychoactive side effects of marijuana are really not that severe. They're bad, I hate them, I don't like them, But compared to some of the other things I've been through, including psychoactive side effects of the medications I've been on, it's really a much lower order of magnitude.